Assalamualaikum warahmatullahi wabarakatuh. My name is Udaimatullah binti Muhammad Baharudin, and my group members are Amirah Imran, Nur Anis Farhana, Nurul Syafiqah, and Rabiatul Nabila. Today we're going to present about the assessment of functional status and quality of life. For the introduction, functional status refers to a person's ability to maintain a psychological and physical well-being, to work independently, to manage with life stresses and daily difficulties. It enables the person to make better decisions psychologically, physically, emotionally, and spiritually, to deal with the surrounding challenges, to participate in society constructively, and to achieve happiness in the everlasting state. Functional status has long been regarded as a crucial result, particularly for disabled and chronic disease, which comprises a rising part of the burden of the disease. It can be assessed in several different ways, usually with a focus on the person's abilities to perform basic activities of daily living, which include basic self-care such as bathing, feeding, and toileting, and instrumental activities of daily living, which include activities such as cooking, shopping, and managing one's own affairs. Next, quality of life is a multidimensional concept that refers to an individual's perception of their position in life in the context of the culture and value system in which they live and in relation to their goals, expectations, and standards, and is affected by personal physical health and psychological state. For this purpose, several health-related quality of life instruments were developed. For a number of objectives, the HR called instruments are valuable, including the assessment of the impact of disease and or treatment in clinical trials and everyday practices.
Hi, I'm Nurul Syafiqah and I will present about disease-specific quality of life instrument. We have choose Diabetes Quality of Life or DQOL, which was developed in the early 1988 for use in the Diabetes Control and Complications Trial or DCCT. Diabetes Quality of Life Clinical Trial Questionnaire, Diabetes Treatment Satisfaction Questionnaire, Diabetes Specific Quality of Life Scale, and Audit of Diabetes Dependent Quality of Life are among the versions of Diabetes Quality of Life or DQOL. But all of them have their own integrations and specific measurements. For example, Diabetes Treatment Satisfaction Questionnaire is only applicable to type 2 diabetes, while Diabetes Specific Quality of Life Scale is only valid for type 1 diabetes. So here are the example of questions that were listed in the DQOL. DQOL has 46 score items with two general formats. The first one is regarding the frequency of negative impact of diabetes or of the diabetes treatment. While the second format is about satisfaction with diabetes treatment and quality of life. DQOL has 4 domains, which those domains are highly relevant for: first, treatment satisfaction; second, treatment impact; third, worry about long-term complications of diabetes; and lastly, worry about social or vocational issues. So all the questions that were listed in the questionnaire are based on these domains to assess patients' perception of how diabetes can affect their quality of life in terms of physical, psychological, and social functions. DQOL are based on 5 points of Likert scale, which score of 1 indicates no impact or always satisfied, while score of 5 indicates always being affected, always worried, or never satisfied with their quality of life whenever relates to diabetes. Lastly, the higher scores obtained indicates that the patient is always dissatisfied, facing frequency of problems with severe long-term complications of diabetes.
So next is separated instrument for functional status assessment. We have two. One, activities of daily livings, and two, instrumental of activities daily livings, IADL. So for the activities of daily livings, ADLs, the feature is a patient's ADLs can be used to evaluate the success of a treatment program. ADLs include self-care tasks such as dressing, maintaining continence, bathing, toileting, grooming, transferring, and feeding. So the specification of this ADL, the most used scale is CATS Index of Independence ADS. The clients are scored yes or no for independence in each 6 function. So the scores of 6 indicates full function, 4 indicates moderate impairment, and 2 or less indicate severe functional impairment. So, the strength and limitation for this CUTS index of independence in activity of daily living, the CUTS scale does not evaluate more advanced daily activities. And this CUTS ADL scale is sensitive to changes in declining health status, but it is limited in its ability to measure small elements of change seen in all the added rehabilitation. The strength is it is useful in develop a common language about patient function and healthcare providers involved in overall care and discharge planning. Okay, next we have instrumental activity of daily living ADL. The feature is IADL in the context of rehabilitation is to determine the individual's level of need for assistance and cognitive function. So IADLs includes tasks such as using phone, shopping for groceries, preparing meals, performing housework, doing laundry, driving or using public transportation, taking medication, and handling finance. Specification of IADL is the most used scale for this IADL is Lawton Instrumental Activities of Daily Living scale. So this Lawton is used to assess the independent living skills of the patient or people. The instrument is to determine how person is functioning right and to identify the improvement or deterioration over time. Individuals are scored based on highest level of functioning in each category. So the summary score range from 0 to 8, which 0 means low function and dependent, while 8 means high function and independent. The strength and limitation for this IADL is Lawton scale. It is simple assessment tool which it can provide information about functional skills required to live in community. So identifying specific deficit can help nurse and other discipline for safe discharge. This scale limitation is it is self-administered, so it can result in overestimation and underestimation.
Hi, I will continue with generic quality of life instrument. Generic device has been designed to evaluate HR quality of life in a wide variety of groups with or without chronic disease. While generic instrument may not be sensitive enough to detect change in HR quality of life in particular disease. These measurements are commonly used is SF36, WHO Quality of Life BREF, then Pediatric Quality of Life Inventory. So I'll choose 36 item short form survey, which is SF36, where the purpose of SF36 is health survey that frequently measure of health-related quality of life that give a complete approach to assess health from the patient perspective that has been verified in a variety of languages throughout the world. It has 36 question multicultural measurement that has been divided into 8 domain profile of scores. For the features, the SF36 is a single measure developed from 7 of SF36 8 health dimension for use in economic evaluation or determining quality at just life periods. The GH, or we call it general health domain, is removed, and the role physical and RE domains are consolidated into a single domain. So the specification is there are 8 domain for questionnaire, which physical functioning 10 item, general health 5 item, role physical 4 item, bodily pain 2 item, social functioning 2 item, vitality 4 item, role emotional 3 item, and mental health is 5 item. This is from Abasi in 2020. Okay, this table shows as after this measurement model, there are physical functioning, neurophysical bodily pain, general health, which either healthy, vitality. They are for physical. There are 2 summary structure, which is physical health and mental health.
Assalamualaikum warahmatullahi wabarakatuh. My name is Abiyatul Nabila binti Zainal Abidin. For my part, I have chosen objective functional status assessment, which is hand grip strength. Firstly, the function of hand grip strength is to measure muscular strength or maximum force that generated by the muscle arm. Usually, hand grip strength was tested at elderly age 60 due to aging and also due to lost muscle strength. Grip strength in midlife can predict physical disability in senior years and can help evaluate patient health. Hand grip strength was as valuable marker of well-being as muscle strength need to be carried out activity of daily life or ADL. For this test, tools that needed is only JAMA dynamometer and tested only for 5 minutes or maybe less than that based on the patient health. And lastly, maximal grip is mean for 3 trial for the result. Next, for this slide, it shows scoring table for hand grip strength for male and female. It was based on their categories and age. Age is from 50 until 99 years old and has 3 categories, which are weak, normal, and strong. It has a difference between score for male and score for female.